Welcome back to Poliklinik MUC's game show, where this week Dr. Lynda from Poliklinik MUC Labu Negeri 9 and Dr. Ray from Poliklinik MUC Bukit Bintang will compete in answering the meaning behind the 10 medical terms that everybody should know. The first word, acute.
I think it's something that is severe, that happened in a short period of time, and it's very severe. It's not something that has been on a long term. It's a sudden something that happens suddenly and is serious. So usually we use the term acute. Heart attack is something that's acute. You see?
Okay, cool.
But if you have diabetes, it's something that's chronic, long term.
Next, FBC.
It's a full blood count where we take your bloods to see whether there's any infections in your blood, either viral or bacterial, and we can see any diseases of the blood also, such as anemia or.
How about LDL?
It's part of your cholesterol screening. So there's HDL and there's LDL. So LDL is what in layman's term they call the bad cholesterol. HDL is the good cholesterol, and the total of that will give you the total cholesterol in your body. So LDL is so-called the bad component of the cholesterol.
Hypertension.
Okay, hypertension is one of the three major diseases in Malaysia. Triads we call it triads in Malaysia, which is obese, hypertension and diabetes. So hypertension is when your blood pressure is high, where you measure it with a BP machine.
Sphygmomanometer.
Yes.
LFTs.
So LFT is basically liver function test, which is the parameters which we'll see when we test the liver. So there are certain parameters and levels which we'll see whether the liver is healthy and functioning well. So LFT stands for liver function test. So test untuk hati, is it? Hati, right? Hati, yes.
Negative.
Yeah. So usually negative will relate to something which we have yes or no parameter. Like for example, if we're doing a screening of something, and to say that you are negative or positive for something, you will say your negative means you don't have it, your positive means you have it.
Catheter.
Catheter. Yeah, it's like a tube that we insert in your urinary for helping some of the patient which is bedridden, for example, for them to pass urine. So we will insert the catheter there.
Abrasion.
Oh, I thought Dr. Lynda. Okay, abrasion is just like a superficial skin tear which doesn't go through the dermal layer, right? Yes, dermal layer. I'm asking. Yeah. So it's a very superficial, most probably just a superficial layer of the skin that is affected. Usually you will get this kind of abrasions when you have a simple fall from your bicycle or motorbike. So lacerations will be something which penetrates. You can see blood vessels, you can sometimes see tears which are much more deeper and requires suturing. Abrasions just doesn't require suturing, it's just a superficial tear, just normal dressing on the top surface will do.
Abscess.
Abscess can happen anywhere actually. It's a collection of an infection either under your skin or any other parts of the body. So it's a collection of infection inside that area, confined area.
Nana,
yes, Nana.
Anemia.
So anemia is when you're a state where you have very low hemoglobin in your blood. Okay, so they call it anemic. So there are certain ranges. It ranges different for males and females. I think females anything below 11 or 10, and then males anything below similarly also 7 or 10. So it is considered an anemic state where your hemoglobin level, sel darah merah di badan adalah rendah. So then you start experiencing symptoms like dizziness, palpitation, shortness of breath, difficulty breathing, sometimes even dizzy, even faint. So for the girls, sometimes if they have heavy period, menses which have heavy flow in blood, they can experience this symptom. So anemia.
Join us again next week for another 10 medical terms that everybody should know. See ya!